Welcome to AHVC Heart Channel, a podcast that explores the wonders of the human heart. I'm your host, Joseph. Today in this episode, we have Dr. Jeremy Chow here with us to share about smartwatch and the management of atrial fibrillation. And we are very excited to learn more from you. Welcome, Dr. Jeremy.
Hi, Joseph. Hello, everyone. My name is Dr. Jeremy Chow. I'm a cardiologist and also an electrophysiologist, also known as a cardiac electrician. And I'm currently working in Asian Heart and Vascular Center.
Dr. Jeremy, what is atrial fibrillation?
Atrial fibrillation is the most common arrhythmia, which is an irregular heart rhythm that we see in patients who are above 60 years old. Commonly presents because of certain risk factors like high blood pressure, sleep apnea, and unfortunately, as we get older, the risk for atrial fibrillation will also go up. It is the most important arrhythmia to detect because it is associated with an increased risk for stroke.
What are the symptoms of atrial fibrillation?
Atrial fibrillation, otherwise known as AF, it is actually silent in about 50% of the patients. So most patients may not have any symptoms. They will probably only find out that they have this condition after one ECG, maybe in the GP clinic or in the specialist clinic or in health screening centers. But if you do have symptoms, the most common symptoms will be a palpitation. So you will feel your heartbeat. Normally, we do not feel a heartbeat, but if you start to feel a heartbeat, especially if the heartbeat is irregular, then you may have atrial fibrillation. Some patients may also describe the feeling of the heart fluttering as atrial fibrillation. Uncommonly, but we do see this in some of the elderly patients, they present with fainting spells. So they actually black out, faint, and have an injury.
Is monitoring of this condition crucial, and why?
The monitoring of this condition, I would say, is useful for patients who have atrial fibrillation. So first, we have to diagnose atrial fibrillation, which is commonly done using an ECG. And if we cannot get a diagnosis from ECG, we will do a 24, 48, or 72 hours Holter monitoring to pick up atrial fibrillation. Once we pick it up, usually patients will be recommended to have some treatment. And the monitoring of the response to treatment is useful because it will tell us whether this patient responds to medications. And if they do respond, we can keep them on medication. And if they do not respond, then maybe they need other treatments for atrial fibrillation.
What tests will you do for the patient to find out if they have atrial fibrillation?
So the most useful and common test is an ECG, which can be done in most primary healthcare, GP clinics, and also specialist center. But unfortunately, atrial fibrillation doesn't present all the time. So when you first have atrial fibrillation, it is often intermittent, means it comes and it goes. So if you take an ECG, like taking a photograph of that patient at that point in time, you may not see atrial fibrillation. So if we don't see atrial fibrillation on an ECG, then we will advise the patient to do Holter monitoring, which can be up to 5 days. Commonly, we will do 48 to 72 hours.
What are the treatments available for patients who are diagnosed with AF?
Okay, so when it comes to treatment of atrial fibrillation, we need to treat two things. First, we need to reduce the risk for stroke. So for those patients who have a higher risk for stroke based on the risk score, they will need to take a blood thinning medication or what we call anticoagulation. That is to reduce the risk for stroke. The second thing that we do for the treatment for atrial fibrillation is to maintain normal heart rhythm. So we are all born with normal heart rhythm. So if we can maintain normal heart rhythm, then it is good for the patient in the long run to prevent heart failure and also decrease the risk for stroke. So using medications called antiarrhythmic agents will be able to maintain the rhythm, failing which then we will use procedures such as ablation.
How do smartwatches assist in the detection of atrial fibrillation?
Okay, this is a very good question and it's a very commonly asked question. Is it possible or useful for me to buy a new smartwatch that can help me to assess my condition? So firstly, I will mention that smartwatches are getting better with their AIs and therefore some of the companies have come up with algorithms to detect atrial fibrillation. For the purpose for atrial fibrillation, I think it is only useful if you have a diagnosis of atrial fibrillation, or if you have a risk factor for atrial fibrillation. For example, if you have never had atrial fibrillation before, but you are hypertensive, you have high blood pressure, you have sleep apnea, you have thyroid conditions, then maybe a smartwatch should be useful to detect the silent atrial fibrillation because, like I said previously, 50% of patients do not feel any symptoms. The other group of patients I feel will benefit a lot from smartwatches are those who have already had a procedure done, for example, ablation. Then they will know after the ablation what is their atrial fibrillation burden, if there's any, and whether they are fine. Because at some point after the procedure, we will stop all the medication and let the patient live back his normal life.
How accurate and reliable are smartwatches in detecting atrial fibrillation as compared to traditional medical devices?
Detection of atrial fibrillation sometimes is by opportunity, right? So if you wear something longer, you are more likely to pick it up. So if you have a smartwatch and you're going to wear it every day and you just take it off an hour to charge, then the likelihood for you to detect that condition is going to be higher than if you do a test for, say, 72 hours. Because if that 72 hours was a very fantastic, good 72 hours, you're not going to see anything. Maybe at the 75th hour, you'll see something, but that won't be recorded anymore. But whereas in a smartwatch, you can always wear it, take it off, charge it, wear it again, and you'll be able to get information. So I think the accuracy depends, unfortunately, on the brands, because currently there are only a few brands that have validated AI algorithm to detect atrial fibrillation. So if you buy a good, reputable brand smartwatch, then the detection rate is more accurate.
Could patients monitor their heart just by using smartwatches?
You can monitor a few parameters on the smartwatch. For example, what is your average heart rate, your resting heart rate, your maximum exercise heart rate, other things like heart rate variability, as well as it will pick up atrial fibrillation if you have any. So you can monitor all these parameters using the smartwatch, but just as a caution to everyone who is tuning in right now, it is not a useful device to pick up things like heart attack or risk for getting heart attack or sudden death, because there have been no AI algorithm to detect all these things. And furthermore, the smartwatch only has one ECG strip. Most of the time when a cardiologist sees the patient and do an ECG, there are 12 ECG strips. So the smartwatch only has 1 out of 12 of the ECG strips. So it's not that accurate to pick up other heart-related conditions apart from atrial fibrillation and arrhythmias or palpitations.
Do you include data from smartwatches into the overall treatment plan for your patient?
Personally, I do, because I think for those reputable brands, smartwatches, they already have algorithms that are validated. I use it as a form of continuous monitoring for patients who already have procedures done. So if they have gone for AF ablation, most of them will at some point go and buy a smartwatch, and if they do, then I'll tell them these are the brands that are validated and you may consider one of those brands. And subsequently, those data that they have is useful to let me know whether the treatment was successful or not successful. There are also patients who are not keen for a procedural treatment. Then the medications that we prescribe, we normally do not know how efficient they are or efficacious they are. But if the patient has a smartwatch with an algorithm, they can detect the percentage of atrial fibrillation. So for example, before you start treatment, your AF burden, say, is 30%. After you start medication and your AF burden comes down to 3%. So we know that this medicine is very effective. At some point, patients will always come to us and say, you know, doc, I've been taking this for a while, can I cut the medication? So with a smartwatch, I said, okay, we can try that. We can reduce the medication since the effectiveness is so good, and then see what happens after that, right? So if the control is still 3%, then we know that the patient can be well controlled with the lowest dose of the medication. But if the AF burden goes up, then we know that this patient will not benefit from a lower dose of the treatment.
Can you share any example or case study where smartwatches has significantly improved patient outcome?
Well, I have a couple of patients who, after ablation, they went to purchase some smartwatches which have validated AI algorithm for AF. For those patients, actually, it's very useful for me to know whenever they feel some palpitations, because after the procedure, some patients do get some symptoms. They will be able to use their smartwatch to do a simple ECG, and the smartwatch itself will be able to tell them whether their rhythm is normal or in atrial fibrillation. And if they're unsure, they can always send those informations over to the clinic, and then we can also give them an advice after looking at it. So in a way, it is very complementary and useful for patients who have a procedure done. I also have a couple of patients who are not keen to do procedures, and because of that, they want to try medications. So for those patients, when they purchase a smartwatch, it's able to help them see the effectiveness of the treatment. So some of them may have an AF burden of more than 30%, but after treatment, the AF burden drops significantly to less than 1%. And I think if the patient has no symptoms and the AF burden is reduced, the medication works very well, then those patients can avoid any procedures that are invasive until symptoms develop.
Any take-home message for the viewers or audience?
AF or atrial fibrillation is a very common condition, especially after the age of 60 years old. So I think if you are above the age of 60 years old and you have risk factors such as hypertension, or if someone tells you that you snore very badly when you sleep, or if you do have thyroid problems or other existing heart conditions, including heart valve problems, you should do regular ECGs to check because 50% of patients can have silent atrial fibrillation. But if you have palpitations, please do not ignore them. So if you feel any irregular heartbeats or very prominent fast heartbeats, please go and see your family doctor or GP or go to your friendly cardiologist and get some tests including ECG or Holter monitoring done so that you can pick up AF early and treat them early. If not, the consequence of AF can be irreversible, including a devastating stroke.
That brings us to the end of today's episode of AHVC Heart Channel. I hope you found our conversation with Dr. Jeremy as informative as I did. Heart health is a topic that cannot be emphasized enough, and we are very honored to have you share with us today. If you enjoyed today's episode, please don't forget to share this episode with your loved ones. Stay tuned for the next episode. Thank you, Dr. Jeremy.
Thank you, Joseph.